All right, is this, am I in control here?
You
Yep,
are?
you are.
Okay, good. All right, so I was beginning to tell you about how I got into advocacy and how I discovered stigma. It's been an amazing journey, and what I've come to realize is that there's an incredible amount of work to be done, but having a purpose and a mission is life-changing. So what is stigma? Stigma is the situation where a person's condition, in this case, let's use the word migraine, is deeply discrediting and may elicit some form of community sanction. So not only is somebody discredited for their migraine, but they're punished for it. They're not given equal rights. They're not given sympathy. They're not respected for their journey. They're discredited, and they're punished in terms of access to resources. What are the types of stigma? So in a sense, the biggest, in a way, not necessarily the most important, is structural stigma. And one finds that in policies and laws and practices. So I'm going to give some examples of structural stigma. NIH spends about 1/20th of the amount of money that it should spend on migraine research relative to the impact of the disease. Who do we approach about structural stigma? The NIH, policymakers, HR people, employers, criminal justice, and we try to change policy. So in the world of stigma, the Alliance for Headache Disorders Advocacy is doing much of that work. Public stigma are stereotypes, prejudice, and discrimination. This is what people experience all the time. Those subtle things, those statements, the lack of understanding, the lack of sympathy. Imagine for a moment if the reaction you got to having a migraine and not being able to do something because of it was similar to if you twisted your ankle, or if your diabetes was out of control, or you were feeling faint because of a heart condition. Imagine if you got understanding, respect, and based on not having a stigmatized disorder. Instead, people with migraine, well, what did you do? What was the trigger you were so careless as to expose yourself to? Can you imagine if we said, if a person said their diabetes was out of control and they were having a blood sugar thing, if you said, well, if you hadn't eaten that piece of cake 20 years ago, you wouldn't have this problem. Or if you twisted your ankle, can you imagine if somebody said, well, you should have looked where you were going? But that's basically what people say to people with migraine. And we need to target the general public and people within the groups and, have conversations, educate people in every way possible. There's so much work to be done. And then the worst of these, the most problematical is self-stigma. It's when somebody, actually comes to believe this garbage about themselves, and it becomes part of their psyche. And it ends up in low self-esteem, a lack of engagement in treatment, a lack of, of self-care, depression, anxiety, and people need to recognize this and try to change their internal conversations. And, this goes on through education, empowerment, and peer support. Miles for Migraine is very interested in addressing public stigma and self-stigma. That's what we're all about. It's not, in my opinion, as much about, how fast can you run, or even how much money we generate, although that is very, very important. Most of all, it's about reducing public and self-stigma. And how does it work? Enacted stigma, that's structural stigma and public stigma put together, is felt or perceived. And over time, there's this, what the sociologists call stereotype agreement, where people actually come to believe these negative views that people are telling them apply to migraine. There's self-concurrence, internalization, and eventually self-esteem goes down and there's psychological distress. So, my contribution was to do the first study, and I showed that the stigma of migraine was as great or greater than that of epilepsy, and that it exists when people can't function and that becomes public. So people who have trouble with work, develop the stigma, get the enacted stigma, and develop the self-stigma. And it's at least as bad as what's considered one of the worst neurologic diseases for producing stigma. Now, what about framing? When you think of a disease, that first thing that pops into a person's mind is how the disease is framed. So you think about cancer, you think, oh boy, that's bad. That's the framing of cancer. And the framing of migraine is just not, good, helpful. And it has a profound effect on how the public perceives and supports it. And so much of that comes from, just a headache, or, there's a traffic jam, or that was a migraine. These kind of, it's just the environment about headache is framed in an unhelpful way, in a bad way for people with migraine. But you can reframe a disease. In my lifetime, a number of diseases have been, successfully reframed. Those of you who were alive in the 1980s, may remember how HIV, how negatively it was framed when it first came out, and what a remarkable transition occurred when people stood up, were seen, were counted, and made their voices heard. I think right now, in a very, very different context, we're seeing a reframing going on as we speak in our society. Some other examples of reframing have been impotence was changed to erectile dysfunction, and a cancer victim to cancer survivor. Think about the reframing of autism as another example. And we need a reframing for migraine. So the Coalition for Headache and Migraine Patients, CHAMP, had a symposium about a year ago to try to address and figure out what we should do about migraine stigma. And while we're working on our white paper, it's close to being ready. It's not, so here's what I took away from it. So this is not official. But number 1, 2, and 3 is we have to disclose. The depression, the mental health people have taught us that, that is what is changing. As people come out about their mental health disease, the stigma is going down. And when they tried to frame depression and mental health as a neurologic disease, it's a brain, it's a real thing, that didn't work. It may help the person who has mental health disease, it may help the person with migraine, to look at it that way. And it's true, but it didn't help. So people have to come out. But I think there's more. And really the topic of Jill's discussion, is about disclosure. It's about how to tell your story, because I think it makes a difference. If we don't tell our story in the proper way, we won't help ourselves. One needs to nurture empathy in the disclosure. People need to, understand what you've done to cope with your disease that you have, first that you have it, and how you cope, and the nobility of this struggle, without shame. Talking about the disability. People don't realize how disabling migraine is because everybody's hiding it and not letting people see that this is a disabling disease. So the public just doesn't get it. They don't know. As I mentioned, just saying it's a brain disease, I don't think that's going to help. That's not enough. It's true, but it's not what we should be doing. New frames from other diseases can harm. So we need to study how we're going to frame a migraine. And then we need to take action. If you look at these successful reframing movements, they occurred because all at the same time, the laws, the policies and structural stigma were confronted. Then people confronted other people about their attitudes, and they changed the way they looked at themselves. They found a way to push away the shame of autism, of cancer, of HIV. And we need that for our movement. And that is my talk. I'm going to give it back to Shirley, and she's going to do what she's going to do.
Okay, thanks, Phil. So now you have an understanding of stigma, and part of what we do at Miles for Migraine is we, like I mentioned earlier when I first came on, we're going to have the opportunity to actually practice telling our story, because that's part of the first thing we need to do in advocacy. So in a moment, I'm going to break you up you're going to go into a breakout room, and you will be with one of the peer group facilitators and a couple other people. Dr. Young will go in a room, and our next speaker will go in a room, Jill Dehlin. And here's the question I would like for you to think about. And this is a question you're going to have the opportunity to answer in the breakout rooms. So for a moment, think back to a time when someone said something, did something behaviorally or just figure of speech that made you feel stigmatized. Probably it's one of your most memorable experiences of feeling stigmatized. And you may even remember where you were, who you were with. I even remember every moment of my experience. And so think about that for a moment. And when you go into the breakout rooms, it's important to voice that, to say that, to own that, and to feel acknowledged. So we're going to do that now. We're going to give you an opportunity. I ask that you please keep your story limited to 2 minutes. So we're going to spend 10 minutes doing this, and you're going to go into a breakout room now, and then we will all come back, and then our next presenter, Jill Dehlin, will talk to us about advocacy. So here we go, magic. You might have to click join to get in. Hmm. Okay,
really
welcome back. Sorry to bring you back all so quickly. I kind of messed up on the time, but here we are. Hopefully you had a chance to tell a little bit about yourself and your story. So we're going to actually bring our next presenter on, and we're actually going to go into breakout rooms again. So you will have a chance, if you didn't speak the first time, I encourage you to please think about the next question that will come up after Jill presents to us. So let me introduce you to actually someone who I have had the opportunity to work with one-on-one since starting out in this space. And I'm so grateful to know Jill Dehlin. She started her professional career as a registered nurse in 1975. One of the most gratifying parts of her job were patient education and advocating for people who were hospitalized. She became a health teacher at the age of 40 to help prevent kinds of diseases she was seeing in adults as an office nurse. For Jill, migraine disease manifested itself in 1987 at the age of 32. In 2006, Jill was completing a PhD in educational psychology when migraine attacks became a daily occurrence. After having a negative experience with a headache specialist who was not listening to her, this is advocacy, she decided it was time to advocate for herself. She requested hospitalization and referral to a different practice. She was hospitalized in 2010 and started on a more helpful course of treatment. She got about 30% better after her hospitalization and decided that she was well enough to learn more about migraine disease. So in 2011, she attended her very first American Headache Society meeting in Scottsdale and learned about current research on migraine and other headache disorders. She became involved in patient advocacy on the national level. Jill was the chair of the American Headache and Migraine Association and is currently a member of our own Migraine Warrior Advocacy Board. She is also on the boards of the National Headache Foundation, the Alliance for Headache Disorders Advocacy, and the Coalition for Headache and Migraine Patients. She is the chair of the National Headache Foundation Patient Leadership Council and plays an integral role in the planning and execution of Headache on the Hill with AHDA. Migraine disease is a daily part of life for 40 million people in the United States. Jill is involved with the migraine community, and without her, I don't know what we would be. We would have a much different perspective and forecast on how we're going to eventually get to a cure. So with that, I'd like to introduce Jill.
Hello, my name is Jill Dehlin, and let me get my slideshow up here. Shirley, thank you for that fabulous introduction. I really appreciate it. Get to the view and slideshow. Ta-da! Can you see it?
Yes, we can.
All righty. Well, I'm going to follow up with Dr. Young's great presentation on stigma and show you how you can weave our knowledge about stigma into your own advocacy efforts, making the invisible visible. So what I'm going to share with you is ways that you can reframe perceptions of migraine, and not just your own perceptions, but that of the public and that of our policymakers. We like to think about stigma as three separate entities, but actually they're quite interconnected, as you can see on this Venn diagram. So the examples that people gave in their breakouts really did show how public stigma can influence the way we feel about ourselves. But public stigma, structural stigma, and self-stigma are all interconnected. And unfortunately, it's a cycle that perpetuates itself. And the best way to bust out of this horrible cycle of stigma with regard to migraine is to use self-advocacy. So self-advocacy stops this stigma cycle. And Miles for Migraine created this nifty handout for you that everybody's going to be getting an email copy of. And these are all tools that we can use to help fight stigma: self-disclosure, joining a supportive community, educating ourselves, asking for help, educating, and going live. So I'm going to be talking about those steps. The first step to our advocacy journey is self-disclosure. And it's really important to speak up. Self-disclosure is a powerful tool, and sharing your story can be very empowering. Each time a person with headache disease tells their story, we chip away at all three types of stigma and end the stigma cycle. What you share is really up to you. You can just share with your friends, your family, your employer, school administrators, teachers, and the world. You may find that there are others in your circle who have had similar experiences, and you probably will find that because migraine affects 12% of all people, and it's the most disabling condition among people of childbearing age. So use self-disclosure, put it out there on social media, make your steps forward as big or as little as you feel comfortable with, and speak up if people are using stereotypes about migraine against you. Tell them your story, educate them. Think about your migraine superpowers. My personal superpower is after I've recovered from a migraine, I feel like I can do anything. That's my superpower. But finally, when you're self-disclosing, don't be afraid to ask for help if you need it. Miles for Migraine is just starting a new initiative for you to tell your own story with the Humans with Headache Diseases initiative. And I hope Shirley will tell us a little bit more about that later. Use positive and affirming language. This slide is from the CHAMP language and image guide, and it's to help us reject traditional labels by empowering ourselves and helping our disease to be taken more seriously. So instead of telling people that you get headaches, tell them that you have migraine disease. Having a migraine headache is not as impactful as telling people that you are having a migraine attack. When you say you are suffering from something, it makes you seem like a victim. We are not victims. We are survivors. We are patients when we're in a physician's office, but we are people first. So reject these labels that we give ourselves, and other people will help take us more seriously. This can help stop stigma. One of the things from the CHAMP language and image guide that I thought was really important was this quote: "We aim to have our struggles against these painful and disabling diseases honored. We, to the best of our ability, will make headache diseases visible." So quit being invisible. Share your story, but prepare in advance if you need to. Think about those types of situations that we talked about in our breakout session, those unintentional or intentional stigmatizing moments, and figure out what you're going to say in advance. I personally am not quick on the draw when it comes to responding to people when they insult me. And so I always go away like 10 minutes later thinking, oh, I wish I would have said X, Y, Z. So figure out what you're going to say when those kinds of things happen. And remember that your verbal and your nonverbal communication are really important. And be assertive, but not aggressive. And this means being respectful, being confident, but relaxed, making eye contact, sitting or standing tall, speaking in a calm, clear tone, but moreover, not apologizing. The majority of people who have migraine are women. And this is something that I personally am trying to avoid doing, is apologizing for my condition. The more you do this, the easier it becomes. Shirley mentioned when I had that toe-to-toe discussion with my physician, I recited my story in front of a mirror because I didn't want to chicken out and I wanted to make sure that I said the right things. The next point is to join a supportive community. You can find lots of great support groups on CHAMP website, but Miles for Migraine is a great start on your advocacy journey. The important takeaway is to remember that patients have to take the lead, and policymakers pay more attention when people with the disease advocate for themselves. There is much power in numbers and in knowing that you're not alone. Step 3, continue your education about your disease. My goal when I went to the AHS conference was to stay one step ahead of my doctor. And by learning as much as I could about migraine and about the treatments, then I could interact with my doctor in a much better way. I became a partner and not a bystander in my health care. Know how to treat it, the medicines, the devices, how to take care of yourself, and learn more by checking out the CHAMP website for information about the language and headache guide or other great information about our disease. Learning about our disease will help us improve communication between us and our healthcare provider. And research shows that improved communication leads to better outcomes. Don't be afraid to ask for help. Dump the guilt and ask for the support that you deserve. Support is available for people with migraine. The Americans with Disabilities Act, the ADA, provides accommodations for people with migraine. Talk to your coworkers about lighting, fragrance, and noise issue. Call HR or your union if you need to. Schools can also and must provide accommodations to students with schoolwork by filing a medical 5014 or an IEP. That's an individualized education program plan. Adults disabled by migraine can apply for Social Security disability. And self-care is so important and often neglected. Take time for yourself. Get enough sleep and exercise. Eat right and don't skip meals. Keep hydrated. Limit your screen time. If you're having an attack, just be honest. How many of you respond fine when you're really not? I used to too. But the people that know me and love me can usually tell when I'm having a migraine because I like to say that the shades go down, and my tell is that my left eye gets droopy. So the people in my circle can usually tell anyway. But when you say that you're fine, you're minimizing what it is that you're going through. So don't be afraid to share. People who know you can, if you have a chronic disease, you wouldn't be embarrassed to practice self-care, or as Dr. Young said, tell people if you had diabetes or some other chronic disease. When I had ankle surgery, I got so much sympathy because I was wearing this boot. But why do we stigmatize ourselves with migraine? We don't need to do this. Think of some things that you can or already do to take care of yourself. The next step is to go live. This is the last step. Miles for Migraine is a great example of public advocacy. Wear your shirt. Ask your family and friends to attend if you aren't able to go to an event. Going live fights public stigma and educates others. Win-win. I went an extra step and put this purple in my hair. So when people comment to me about it, which they often do, I tell them, purple is the color for migraine advocacy. I have migraine disease. Do you need any information or have questions about migraine that I can answer? See, I'm going live. I'm using public advocacy and educating others by using affirming and empowering language. I am owning my own disease. You can do the same just by wearing purple or your Miles for Migraine t-shirt. So I want you to think about how you can employ these self-advocacy tools of self-disclosure, joining a supportive community, continuing your education, and asking for help and going live. I'd like you to make some long and short-term plans. Think about the types of stigma as you make your plan. Think about self-stigma and examine your feelings about having a chronic disease. Dump the guilt and the negative labels that you give yourself. For public stigma, change the conversation from a negative to a positive and educate others. Public advocacy can be as simple as sharing a Miles for Migraine post on social media or posting information to your friends on Twitter or Instagram. You can also write letters or visit policymakers and get involved with advocacy organizations. Think about the times when a friend, a family member, acquaintance, coworker has recommended some outlandish treatment. I think probably the most ridiculous one that I've heard is putting a banana peel on my forehead to help a migraine attack. How do you handle that? What could you do differently? Be prepared for that and be ready. The last was structural stigma. This includes educating rule makers about migraine and making sure that ADA accommodations are being followed. You can just keep it local or go national by attending Headache on the Hill with the Alliance for Headache Disorders Advocacy. Attend an advocacy event that helps change stigma. So these are all things that you can be thinking of. And now we've come to our second reflection, is develop your own plan. So what is your plan of action for increasing your advocacy? Feel free to share any advocacy initiatives you're working on, including self-care. Make the invisible visible. Thanks.
Thank you, Jill. Now, we all have great ideas that Jill has put forth. We're going to go into breakout rooms again, and we're going to only spend about 8 minutes. And then I'm going to bring you back in here, and we're going to go to our next presenter. I have to look at the schedule. No, I think we have a break. So here we go. We're going to go into rooms, and we are all going to state what our plan of action is. So it's good to voice what you're going to do. Here we go. Are some of you not in breakout rooms? It looks like some of you are not. You're still here. I'm not sure why.